My name is Dr. Chris Colgin. I'm a chiropractor for the past 21 years. Well, what led me to become a chiropractor was I hurt myself trying out for the wrestling team at my local high school here in San Mateo called High School. And as a result of that injury, the coaches were very concerned. So they said, go see a doctor first to get clearance to see if you could practice again. Well, I did that, but some friends of the family said, nah, don't go see the orthopedic, go see this chiropractor. And they referred me to a chiropractor, and I had no clue what I was getting into, but my father said this would be a great choice. I think you're really going to like this, Chris. So we went, and I received my first adjustment, and life hasn't been the same since. So a couple years later, I got into a serious car accident, and since I was already kind of wondering if this is a career path I want to be, because this was in my sophomore year of high school when I first started chiropractic care. My car accident came my junior year. After the accident, I went right back to my chiropractor to get the care needed to recover. I recovered so quickly, it definitely solidified my decision in making chiropractic my career choice. See what's happening. All right.
Okay.
Moment of truth, Bonnie.
Here we go.
Okay.
It's not looking good, is it?
No. So we are 44, 5'8", 150 pounds. Okay. Computer breaks down into 4 categories. Green is good, yellow is high risk, and red means danger zone.
Oh dear.
Got in the red, you seriously got to consider investing in your health.
Okay.
Now look at you, you're a rock star here. All right, so we'll start off with, your body mass index. If we want it to be under 25, you're at 22.8. You're right in the green. Perfect for your height, age, and weight. Through the years, we're starting to see how, with the patients we were seeing for mostly pain or some kind of, structural dysfunction in their body, we found that over time people were starting to gain a little bit more weight than usual. And we also found too that if we could help get that weight, especially off their abdomen, the low back pain would go away. They'd actually have more energy and just feel and function a lot more efficiently. Water, yeah, you're loving it, okay? Life is good.
Okay.
Okay, the other thing too is your water. What that means, when we think of water, when we measure it, there's 2 kinds of water. You got the water underneath your skin, it makes it feel like you're retaining water, that you're bloated. This is measuring the water in your cells. How hydrated are you? Okay. I like people to be between 40 and 60. Since we do a lot with weight loss here, it helps us that much more moving in that fat burning zone. So hydration is a key to this program. I would then inform the client or patient, something's coming down the pipeline, don't know what, don't know when, but something's happening. You may know about this, so we got some work to do.
Okay.
And so what's neat is we do this every 2 weeks when someone comes in, and some offices do it weekly. I like to have them come every 2 weeks, that way I can see less of them.
Yeah.
Because they're going to transform, and so that's what we take a picture of them right here. I'll do a full top to bottom, then their face, and then a side view, and then I text it to them.
Yeah.
And then every 2 weeks when they come in, we do the same thing, and they can see the difference.
Amazing.
Yeah, so we really like to leverage technology here. As simple as that.
Yeah. Oh, this is so exciting.
Yeah, and that's for you. There you go. The results have just been fascinating. They've been very rewarding, and I say that in a way where there's nothing better than seeing people transform right before you. And we've had people that have been diagnosed with type 2 diabetes for years. And then after just a few, maybe 2 months, they've been able to reverse it. Some people even sooner, because they've been taught how to properly eat. We help them, burn that fat off their body so they can function better. And we also teach them we could teach them, but also teach them how to eat the right foods to maximize their blood glucose levels. The other things we do here too is our thyroid patients, or people that have a lot of digestive distress problems, inflammatory disorders. All of them are going by the wayside as a result of us teaching them how to properly eat, get that weight off. And a lot of these more difficult cases that people come in for that you would think would take a lot of time, well, by showing them just the bare basics, the foundational basics of taking care of yourself with food and their lifestyle, we've seen some amazing results in under 1 to 2 months with certain people. So it's been very rewarding. You're 44 years young, but you got the metabolism of a 39-year-old.
Wow. Wowza.
Yeah, okay. So that's your true metabolic age.
Okay.
And then we also have other technology here too that we use, where I put a clip on your finger here, and it's a digital one. I'll set that up, but what it does is it sends a pulse wave through your arteries and your aorta, which is the largest artery in your body. Tells me what is your oxygen saturation, your SpO2, your heart rate, but it also tells me how much, is there any resistance in your arteries or aorta that could dictate a possible inflammatory response, and it tells me what is the true biological age of your arteries in your work. Well, just like anything in life, there's good and bad in every profession or any profession. And so and believe me, we have clients that come in here too that we thought helped, but for some other reason they may have gone to other places. That's fine. It's a universal law of how we help people. But I would say find a chiropractor that works best for you. I have to be very diverse. I don't just focus on the spine. We're in an area now where we're typing a lot. We're in front of a computer quite a bit, so we work on the arms, the wrists, the elbows, the knees, the hips, the ankles, even the jaw is something that people tend to have problems with. So we take pride in being able to realign those areas of the body so people can get their function back, get out of pain, and just carry on with their lives, a lot more powerfully than they did before.
Try to do is we just find out what people are looking for, what are their goals, and what are they looking for, so that way we can help them, give them what they want.
Yeah.
One of the things we always ask is, what do you want? What's going to make a difference for you? How are we going to help you? How is this going to impact not only your life, but your family? A lot of women come here. They're the ones that represent the health of the household.
Yes.
So I tell them, I go, look, not only am I going to teach you, the word doctor means teacher. I'm here to teach you how to get healthier, not just say, see you later, bye. Good luck, and call me in the morning, right? No, we're going to teach you some sanity skills to be independent of their disease process.
Fabulous.
Yeah, that's the most beautiful thing that we could offer people.
Yeah.
As far as with the work we do here, the basic premise of what we do is what can we do to reduce inflammation in the body. Inflammation is a foundation for just about every metabolic process out there. We're talking about heart disease, diabetes, and even cancer. If we could just show people, just by changing the way they're living and by choosing foods and that are a lot healthier from, and also beverages that are healthier from, and also just to start drinking water more often, it's amazing just how quick someone could turn around their health in a very short period of time. And so we take great pride in teaching people how to do just that so they could have the life they dreamed and be independent and free of their disease process, medications, and frequent visits to their doctors.